Today, we are practicing with questions, answers, and explanations. CNA Resident-Based Competency Practice Test 2026. Do not rush. Try to understand why each correct answer is best. Let's start strong.
Question number 1. Focus on the keywords. How can you help the resident with COPD and his/her family? Pick the best choice from these options. A says ask the family to leave when the resident is experiencing shortness of breath, SOB, to avoid increased anxiety in the resident. B says be patient when working with the resident with SOB. C says speak to the resident in a calm and reassuring manner. D says and C, ready for the answer?
Okay, let's check it. The correct answer is D and C. Great job if you selected that. This answer is correct because residents with COPD may become anxious when short of breath, so the CNA should remain patient and speak calmly. Calm reassurance and patience help reduce fear and support breathing. Sending the family away automatically is not person-centered unless directed by the nurse or care plan. Now you know why that option is best.
Moving to question number 2. Pay attention to the wording. This is a true or false question. Decide whether the statement is true or false. Leaving a resident who is having increased periods of SOB could cause severe anxiety. Here are the choices. A says true, B says false. Choose your answer now.
Okay, let's check it. The correct answer is A, true. Great job if you selected that. This is the key point. This statement is true because leaving a resident alone during worsening shortness of breath can increase fear and anxiety. The CNA should stay calm, provide reassurance, and report worsening breathing to the nurse promptly.
Let's see how you do on this one. Read carefully. If 2 answers seem correct, look for the most complete one. Which approach is important for the resident to understand and use when having increased SOB? Now compare the choices. Option A, deep breathing exercises. Option B, pursed lip breathing. Option C, mouth breathing. Option D, all of the above. Make your selection before I reveal it.
Here is the correct answer. The correct answer is B, pursed lip breathing. If you chose that, you are correct. This is the key point. Pursed lip breathing is the best technique for increased shortness of breath because it helps slow breathing, keeps airways open longer, and improves air movement. Mouth breathing alone is not preferred, and deep breathing may not be as effective during COPD-related air trapping. That is the key takeaway.
Question number 4. Listen closely. Which factor is important to know when making sure a resident's weight is correct? Here are your choices. A is time of day. B is clothing or other items worn by the resident, braces, splints, and artificial limbs. C is wheelchair. D is all of the above. Lock in your answer.
Here is the correct answer. The correct answer is D, all of the above. This is why practice matters. For the exam, remember this. Accurate weights require consistency in time of day, clothing, assistive devices, and wheelchair use. These factors can change the number on the scale and may hide or falsely suggest fluid gain or weight loss. Stay focused and keep going.
Here is question number 5. Focus on the keywords. Swelling, edema, that should be reported to the nurse may occur in. Choose from the following options. A says lower extremities. B says sacrum. C says abdomen. D says all of the above. Try to answer before the reveal.
Let's reveal the answer. The correct answer is D, all of the above. Excellent work if you picked that one. Let's understand the logic. Edema can appear in the lower extremities, sacrum, and abdomen, especially in residents with circulation or heart problems. Any new or worsening swelling should be reported because it may signal fluid retention or declining condition.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. This is a true or false question. Decide whether the statement is true or false. To prevent shortness of breath, sob, it is important to provide rest periods during activities of daily living, e.g., dressing, grooming or walking. Choose from the following options. A is true, B is false. Try to answer before the reveal.
Time to check your answer. The correct answer is A, true. Excellent work if you picked that one. This is the key point. This statement is true because rest periods reduce oxygen demand during activities of daily living. Spacing care and allowing recovery time can help prevent shortness of breath and fatigue.
Question number 7. Listen closely. If 2 answers seem correct, look for the most complete one. This is a select all that apply question. More than one answer may be correct. Review each option carefully. If the nursing assistant, CN. Let's go through the options. Option A sees that a resident with CHF is drinking more fluids than the physician orders, the CNA should. Option A. Take fluids away from the resident and explain it is not on his/her order. Option B. Encourage the resident to follow the plan but report the resident's choices to the nurse and document the resident's fluid intake correctly. Option C. Tell the family that the resident is non-compliant. Option D. Tell the resident that he/she is only harming himself/herself if he/she continues this bad behavior. Pause here if you need more time.
Time to check your answer. The correct answer is B. Encourage the resident to follow the plan but report the resident's choices to the nurse and document the resident's fluid intake correctly. Great job if you selected that. Let's break it down. The CNA should respect the resident while encouraging the care plan, accurately documenting intake, and reporting choices to the nurse. Taking fluids away, shaming the resident, or labeling the resident as non-compliant is not appropriate person-centered care. Good. Let's continue.
Here is question number 8. Focus on the key words. This is a true or false question. Decide whether the statement is true or false. Knowing about the resident with CHF, you can help him/her by telling the team how well the resident can dress him/herself, how long it takes the resident to eat, and if the resident can ambulate safely. Listen carefully to each choice. A is true, B is false. Take a moment to think.
Let's see if you got it right. The correct answer is A, true. Great job if you selected that. Here is why. This statement is true because CNAs observe daily function closely and can report changes in dressing, eating endurance, and ambulation. These observations help the team adjust care for residents with CHF. Stay focused and keep going.
Let's see how you do on this one. Read carefully. If 2 answers seem correct, look for the most complete one. Some of the ways to reduce the effects of altered perception may include. Here are the choices. Option A, increasing the lighting. Option B, placing a colored towel at the bottom of a tub. Option C, evaluating the floor coverings. Option D, all of the above. Choose your answer now.
Okay, let's check it. The correct answer is D, all of the above. Excellent work if you picked that one. Let's break it down. Better lighting, visual contrast such as a colored towel, and safe floor coverings can reduce confusion caused by altered perception. These measures support orientation and decrease the risk of accidents. Now you know why that option is best.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. The following constitutes abuse or neglect. Let's go through the options. A says making it difficult for a resident to request assistance. B says telling a resident to toilet in his/her diaper. C says ignoring a resident who is asking for help. D says all of the above. Pause here if you need more time.
Now for the correct answer. The correct answer is D, all of the above. If you missed it, do not worry. The explanation will help. Here is the reasoning. All listed actions are abusive or neglectful because they deny dignity, safety, and timely assistance. Residents must be able to request help and receive respectful toileting and care support. Keep that in mind for the exam.
Question number 11. Listen closely. Watch the wording here. A resident with dementia may show which of the following behavior changes? Listen carefully to each choice. For A, fearful behavior. For B, crying. For C, wandering. For D, all of the above. Take a moment to think.
Let's reveal it. The correct answer is D, all of the above. If you chose that, you are correct. Let's break it down. Dementia can cause emotional and behavioral changes such as fearfulness, crying, and wandering. CNAs should observe these changes and report patterns or sudden changes to the nurse. That is why this answer is correct.
Question number 12. Listen closely. This is a true or false question. Decide whether the statement is true or false. When a resident with dementia is upset, she may be in pain caused by constipation, hunger, or another unmet need. Here are the choices. A is true, B is false. Choose your answer now.
Now for the correct answer. The correct answer is A, true. That was the best choice. This is the key point. This statement is true because agitation in dementia often reflects an unmet need rather than intentional behavior. Pain, constipation, hunger, thirst, or discomfort should be considered and reported. That is why this answer is correct.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. If two answers seem correct, look for the most complete one. A resident who has an active infection may need additional monitoring of his/her blood sugar because. Listen carefully to each choice. Option A. The resident who is sick may not eat enough. Option B. The resident who is sick may not drink enough. Option C. The resident who is sick may have increased pain. Option D and B. Take a moment to think.
Now for the correct answer. The correct answer is D and B. That was the best choice. Here is the reasoning. Illness can affect eating and drinking, which can make blood sugar harder to control. Reduced food or fluid intake during infection should be reported because it may increase the risk of blood sugar problems. Keep that in mind for the exam.
Here is question number 14. Focus on the key words. The signs and symptoms of low blood sugar are. Here are your choices. A is increased thirst, headache, frequent urination. B is shakiness, excessive sweating, confusion. C is blurred vision and hyperactivity. D is swelling, ringing in the ears. Lock in your answer.
Here is the correct answer. The correct answer is B, shakiness, excessive sweating, confusion. That was the best choice. The main idea is this. Low blood sugar commonly causes shakiness, sweating, and confusion. Increased thirst and frequent urination are more often associated with high blood sugar, not low blood sugar. That is the key takeaway.
Next up, question number 15. Think like you are in the real exam. Why is foot care important for diabetic residents? Pick the best choice from these options. A is routine foot inspection can identify early skin problems. B is moisturizing feet during foot care can prevent cracks in the soles of feet, which can be a source of infection. C is to alert the nurse when nails need to be trimmed. D is all of the above. Ready for the answer?
Let's reveal it. The correct answer is D, all of the above. That was the best choice. Let's break it down. Foot care is important because diabetes increases the risk of poor circulation, reduced sensation, skin breakdown, and infection. Routine inspection, moisturizing is allowed, and reporting nail or skin concerns help prevent serious complications. That is why this answer is correct.
Question number 16. Listen closely. If a resident with diabetes chose not to eat any of his/her evening snack, you would do all of the following, except. Now compare the choices. Choice A, offer an alternative snack. Choice B, report the situation to the nurse. Choice C, tell the resident he/she must eat his/her snack. Choice D, document no snack eaten. Make your selection before I reveal it.
Here is the correct answer. The correct answer is C, tell the resident he/she must eat his/her snack. This is why practice matters. Here is the reasoning. The question asks for the exception. A CNA may offer an alternative snack, report refusal, and document intake, but should not force or tell the resident they must eat. The nurse should be informed. Now you know why that option is best.
Now let's try question number 17. Do not rush this one. Watch the wording here. As a nursing assistant, CNA, you know that. Now listen to the answer choices. For A, pain can lead to decreased mobility, and decreased mobility can lead to pain. For B, loss of muscle mass can lead to decreased mobility. For C, decreased mobility can lead to a decrease in bone density and greater risk for fractures. For D, all of the above. What would you choose?
Here is the correct answer. The correct answer is D, all of the above. If you chose that, you are correct. Here is why. All statements are correct because pain, muscle loss, immobility, decreased bone density, and fracture risk are connected. CNAs help by encouraging safe movement according to the care plan. Keep that in mind for the exam.
Moving to question number 18. Pay attention to the wording. The physical therapist, patient, informs you that Mr. Jones will reach his skilled therapy goals within the next 2 weeks. Although progress has been made, safety with ambulation remains a long-term need. As the CNA assigned to his care, and in preparation for the transition off of skilled therapy, here are your choices. A is attend the training provided to CNAs on the safe and appropriate ambulation assistance required for Mr. Jones. B is encourage Mr. Jones to ambulate following the safety guidelines provided in the training. C is no CNA instruction is needed if the resident is going to a restorative program. D is in B, lock in your answer.
The moment of truth. The correct answer is D and B. If you chose that, you are correct. This is the key point. The CNA should attend training and follow therapy safety guidelines when assisting ambulation. A restorative program still requires staff understanding, consistency, and safe support.
Let's continue with question number 19. Look carefully at what the question is asking. Watch the wording here. This is a true or false question. Decide whether the statement is true or false. Watching the resident to make sure he/she can properly use equipment, such as a cane or walker, is part of the CNA's role in resident safety. Some residents who have had a cerebral vascular accident, CVA, arthritis and other mobility issues can walk safely by using canes and walkers. Here are your choices. For A, true. For B, false. Lock in your answer.
Here is the correct answer. The correct answer is A, true. This is why practice matters. For the exam, remember this. This statement is true because CNAs help monitor whether residents use canes, walkers, and other equipment correctly. Proper equipment use can improve safety and reduce fall risk. Stay focused and keep going.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. Watch the wording here. This is a true or false question. Decide whether the statement is true or false. Assisting residents to take part in the Walk to Dine program and helping them ambulate to the bathroom or to activities are ways that staff help residents stay independent and strong. Listen carefully to each choice. For A, true. For B, false. Take a moment to think.
Now for the correct answer. The correct answer is A, true. If you chose that, you are correct. The main idea is this. This statement is true because walking to meals, the bathroom, and activities supports mobility, strength, and independence. CNAs play an important role in helping residents follow safe ambulation routines. That is the key takeaway.
Let's continue with question number 21. Look carefully at what the question is asking. As a member of the caregiving team, the CNA follows the therapy plan to encourage resident independence and safety while preventing undesired events. Examples of interventions in the therapy plan may include: listen carefully to each choice. Choice A, sliding boards for transfers. Choice B, Jerry chairs. Choice C, Walk to Dine program. Choice D and C. Take a moment to think.
Let's reveal the answer. The correct answer is D and C. If that was not your answer, use the explanation as a learning point. This answer is correct because sliding boards and Walk to Dine can be therapy plan interventions that promote safe transfers and mobility. Jerry chairs are not listed as the appropriate therapy intervention in this item. Keep that in mind for the exam.
Question number 22. Listen closely. If two answers seem correct, look for the most complete one. Routines and consistency can be important for residents who suffer from post-traumatic stress disorder, PTSD. This addresses which human need. Listen carefully to each choice. Option A, caring. Option B, esteem. Option C, safety. Option D, love. Take a moment to think.
Let's see if you got it right. The correct answer is C, safety. Excellent work if you picked that one. This answer is correct because routines and consistency help residents with PTSD feel safer and less threatened. Predictability supports the human need for safety by reducing unexpected triggers. Stay focused and keep going.
Now let's try question number 23. Do not rush this one. If two answers seem correct, look for the most complete one. This is a true or false question. Decide whether the statement is true or false. Out of the ordinary weather, such as thunderstorms or sudden loud sounds, can trigger a post-traumatic stress reaction. Now compare the choices. Option A, true. Option B, false. Make your selection before I reveal it.
Okay, let's check it. The correct answer is A, true. Great job if you selected that. Let's understand the logic. This statement is true because sudden loud sounds in severe weather can trigger traumatic memories or stress responses. CNAs should recognize triggers and report reactions to the nurse. Now you know why that option is best.
Let's see how you do on this one. Read carefully. If two answers seem correct, look for the most complete one. This is a true or false question. Decide whether the statement is true or false. Documenting behaviors as they occur can help the interdisciplinary team identify behavior changes that may be related to illness. Your answer choices are: Option A, true; Option B, false. Think carefully before the reveal.
Let's see if you got it right. The correct answer is A, true. If that was not your answer, use the explanation as a learning point. This is the key point. This statement is true because timely behavior documentation helps the interdisciplinary team identify patterns, illness-related changes, or unmet needs. Accurate observation supports better care planning. That is the key takeaway.
Let's see how you do on this one. Read carefully. If two answers seem correct, look for the most complete one. Alcoholism and drug addiction can be. Your answer choices are: Option A, treated, so there is no excuse for either one. Option B, problem of morality. Option C, sign of a weak personality. Option D, symptoms of an underlying mental health issue. Think carefully before the reveal.
Okay, let's check it. The correct answer is D, symptoms of an underlying mental health issue. Great job if you selected that. This is the key point. Alcoholism and drug addiction may be symptoms of an underlying mental health issue and should not be treated as moral failure or weak character. Residents deserve respectful, non-judgmental care.
Moving to question number 26. Pay attention to the wording. You notice a resident pacing and gesturing angrily in his room by himself, which is not normal for this resident. A coworker is nearby. The best thing to do is? Now compare the choices. A says stay just outside the resident room and ask the coworker to get the nurse. B says enter the resident's room, ask him to lie down and relax. C says leave the area to go get help. D says leave him alone for a while to see if he calms down. Make your selection before I reveal it.
Let's reveal it. The correct answer is A, stay just outside the resident room and ask the coworker to get the nurse. That was the best choice. Let's break it down. The safest response is to stay outside the room, maintain observation, and ask the coworker to get the nurse. Entering alone or leaving the area could increase risk if the resident is escalating. That is why this answer is correct.
Here is question number 27. Focus on the key words. You have a family member at home with pneumonia, and you are starting to cough and sneeze. How can you protect your residents? Here are the choices. Choice A, proper hand washing. Choice B, wear a mask while on duty. Choice C, let your supervisor know about the situation before going to work. Choice D, all of the above. Choose your answer now.
Time to check your answer. The correct answer is D, all of the above. Mistakes are useful when you understand the reason. For the exam, remember this. All actions help protect residents. Hand washing reduces spread, masking helps contain respiratory droplets, and notifying the supervisor allows appropriate infection control decisions before resident contact. Keep that in mind for the exam.
Let's continue with question number 28. Look carefully at what the question is asking. This is a true or false question. Decide whether the statement is true or false. For an older adult with pneumonia, it may take several weeks for he/she to fully recover his/her strength. He/she may need more help to complete tasks. Here are your choices. Choice A, true. Choice B, false. Lock in your answer.
Let's see if you got it right. The correct answer is A, true. Excellent work if you picked that one. The main idea is this. This statement is true because older adults may recover slowly from pneumonia and remain weak for weeks. They may need extra assistance with activities while strength and endurance return. Keep that in mind for the exam.
Let's continue with question number 29. Look carefully at what the question is asking. What symptoms are you likely to see if a resident has pneumonia? Now listen to the answer choices. A says swelling of feet or lower legs. B says shortness of breath, sob. C says cough. D says and C. What would you choose?
Time to check your answer. The correct answer is D and C. Mistakes are useful when you understand the reason. This is the key point. Pneumonia commonly causes cough and shortness of breath. Swelling of the feet or legs is more closely associated with fluid retention or heart-related concerns rather than typical pneumonia symptoms. That is why this answer is correct.
Moving to question number 30. Pay attention to the wording. When residents have pneumonia, which position can help them breathe better if they are short of breath? Listen carefully to each choice. A is side lying. B is elevated at a 45-degree angle. C is lying flat. D is with feet dangling off the edge of the bed. Take a moment to think.
Let's see if you got it right. The correct answer is B, elevated at a 45-degree angle. Excellent work if you picked that one. Here is why. Elevating the head and upper body to about 45 degrees helps lung expansion and can make breathing easier. Lying flat can worsen shortness of breath in many residents. Now you know why that option is best.
Moving to question number 31. Pay attention to the wording. Watch the wording here. Which resident skin change, S, should be reported to the nurse? Now listen to the answer choices. For A, new discolored areas, or areas that are cooler or warmer to the touch than surrounding skin. For B, scars. For C, and, for D, none of the above. What would you choose?
Let's reveal it. The correct answer is A, new discolored areas, or areas that are cooler or warmer to the touch than surrounding skin. This is why practice matters. This is the key point. New discoloration or temperature changes in skin should be reported because they may indicate pressure injury, circulation problems, infection, or other skin breakdown. Old scars alone are not usually an urgent change. Stay focused and keep going.
Next up, question number 32. Think like you are in the real exam. Watch the wording here. This is a true or false question. Decide whether the statement is true or false. A resident has been determined to be at high risk for developing pressure ulcers/injuries. It is enough to reposition this resident every 2 hours. Now listen to the answer choices. For A, true. For B, false. What would you choose?
The moment of truth. The correct answer is B, false. If you chose that, you are correct. Let's break it down. This statement is false because high-risk residents often need individualized pressure reduction strategies beyond routine 2-hour repositioning. The plan may include cushions, skin checks, nutrition support, and more frequent or specific positioning.
Question number 33. Listen closely. What can prevent shear and friction injuries? Here are your choices. Choice A, lifting rather than pulling residents when repositioning. Choice B, properly fitting shoes. Choice C, proper use of mechanical lifts. Choice D, all of the above. Lock in your answer.
The moment of truth. The correct answer is D, all of the above. If you chose that, you are correct. Here is the reasoning. Shear and friction can be reduced by lifting rather than dragging, ensuring proper footwear, and using mechanical lifts correctly. These steps protect skin from rubbing, pulling, and tissue injury. That is why this answer is correct.
Next up, question number 34. Think like you are in the real exam. Watch the wording here. This is a select all that apply question. More than one answer may be correct. Review each option carefully. 1. Role a nursing assistant. CN. Listen carefully to each choice. For A, might play in communicating the importance of consistent pressure reduction strategies would be, for A, encouraging a resident to eat lunch in his/her room while lying in his/her bed. For B, encouraging the resident to eat all of his/her lunch. For C, helping a resident plan pressure reduction rest periods into his/her day. For D, all of the above. Take a moment to think.
Let's see if you got it right. The correct answer is C, helping a resident plan pressure reduction rest periods into his/her day. Excellent work if you picked that one. This is the key point. Helping plan pressure reduction rest periods is directly related to preventing pressure injuries. The CNA supports the care plan by encouraging relief from prolonged pressure while maintaining dignity and routine.
Question number 35. Listen closely. Pressure ulcers/injuries related to improper wheelchair sizing and oxygen nasal cannulas or tubing are examples of ulcers related to. Here are your choices. A is equipment, B is shearing, C is environment, D is in B. Lock in your answer.
Let's reveal it. The correct answer is A, equipment. If you chose that, you are correct. For the exam, remember this. Improper wheelchair size and oxygen tubing can create device-related pressure injuries, so they are equipment-related. The CNA should report redness or open areas caused by devices or poor fit. That is the key takeaway.
Question number 36. Listen closely. A resident with a gel cushion in his wheelchair develops an open area to his coccyx. Potentially avoidable contributing factors are. Here are the choices. Choice A, missed reddened area on skin check. Choice B, failure to reposition per plan of care while in wheelchair. Choice C, unidentified/unaddressed weight loss. Choice D, all of the above. Choose your answer now.
Let's reveal it. The correct answer is D, all of the above. If you chose that, you are correct. The main idea is this. All listed factors can contribute to an avoidable pressure injury, missed redness, failure to reposition, and unaddressed weight loss. Prevention requires skin checks, pressure relief, and reporting nutrition or weight changes. Good. Let's continue.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. If two answers seem correct, look for the most complete one. Which of the following is not a risk factor for falls? Choose from the following options. Option A, medications. Option B, dementia. Option C, daily strength exercises. Option D, gait and balance impairments. Try to answer before the reveal.
Let's see if you got it right. The correct answer is C, daily strength exercises. Excellent work if you picked that one. For the exam, remember this. Daily strength exercises are not a fall risk factor. They can improve strength and balance when done safely. Medications, dementia, and gait or balance problems are recognized fall risk factors.
Next up, question number 38. Think like you are in the real exam. Watch the wording here. Why does a resident try to stand up on his/her own, even if she is weak? Listen carefully to each choice. For A, toileting need. For B, hunger. For C, pain. For D, all of the above. Take a moment to think.
Here is the correct answer. The correct answer is D, all of the above. This is why practice matters. Here is the reasoning. Residents may try to stand because of toileting needs, hunger, pain, or another unmet need. Identifying the reason helps prevent falls and supports person-centered care. Now you know why that option is best.
Let's continue with question number 39. Look carefully at what the question is asking. Which environmental factors in a residence room can contribute to falls? Your answer choices are: Choice A, changes in furniture placement. Choice B, hunger. Choice C, pain. Choice D, all of the above. Think carefully before the reveal.
Here is the correct answer. The correct answer is A, changes in furniture placement. If you chose that, you are correct. This answer is correct because changes in furniture placement are environmental fall risks because they alter the resident's familiar walking path. Hunger and pain may cause unsafe standing, but they are not room environment factors. That is why this answer is correct.
Let's continue with question number 40. Look carefully at what the question is asking. Watch the wording here. Which of the following can be considered a physical restraint and may cause a resident fall? Your answer choices are: for A, jerry chair. For B, placing a resident's wheelchair at a table and locking the brakes. For C, chair alarm. For D and B, think carefully before the reveal.
The moment of truth. The correct answer is D and B. If you chose that, you are correct. The main idea is this. A jerry chair or locking a resident at a table may function as a physical restraint and can increase fall risk if the resident tries to get up. Chair alarms alert staff but are not the same as physically restricting movement. That is the key takeaway.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. Which of the following is not a precaution to prevent falls? Now listen to the answer choices. Choice A, keeping the resident's possessions within the resident's safe reach. Choice B, keeping the resident care areas uncluttered. Choice C, using a bed alarm. Choice D, keeping the resident's bed breaks locked. What would you choose?
Now for the correct answer. The correct answer is C, using a bed alarm. That was the best choice. Let's break it down. Using a bed alarm is not listed here as a fall prevention precaution because alarms do not prevent the fall by themselves. Keeping items in reach, reducing clutter, and locking bed breaks directly improve safety.
Let's see how you do on this one. Read carefully. Watch the wording here. Undesirable results of resident incontinence include. Pick the best choice from these options. For A, increased risk for falls. For B, embarrassment, depression and isolation. For C, increased urination. For D and B, ready for the answer?
Let's see if you got it right. The correct answer is D and B. Excellent work if you picked that one. Here is why. Incontinence can increase fall risk when residents rush to the bathroom and can also cause embarrassment, depression, and isolation. It is not accurately described as simply causing increased urination. That is why this answer is correct.
Now let's try question number 43. Do not rush this one. If two answers seem correct, look for the most complete one. What should be included in avoiding/patterning diary? Here are your choices. Option A, time of toileting. Option B, fluids consumed. Option C, wet or dry at time of toileting. Option D, all of the above. Lock in your answer.
Let's see if you got it right. The correct answer is D, all of the above. If that was not your answer, use the explanation as a learning point. For the exam, remember this. Avoiding or patterning diary should include toileting times, fluid intake, and whether the resident was wet or dry. These details help the team identify patterns and plan toileting assistance. Now you know why that option is best.
Next up, question number 44. Think like you are in the real exam. This is a true or false question. Decide whether the statement is true or false. Urinary incontinence is a normal part of aging. Now compare the choices. Choice A, true. Choice B, false. Make your selection before I reveal it.
Let's reveal the answer. The correct answer is B, false. Great job if you selected that. Here is what you need to remember. This statement is false because urinary incontinence is common but not a normal or unavoidable part of aging. Changes in continence should be assessed, reported, and managed according to the care plan. Good. Let's continue.
Moving to question number 45. Pay attention to the wording. This is a true or false question. Decide whether the statement is true or false. When residents void large amounts of urine during incontinent episodes, it is wise to use a larger brief to contain the urine. Here are the choices. Choice A, true. Choice B, false. Choose your answer now.
Okay, let's check it. The correct answer is B, false. Mistakes are useful when you understand the reason. Here is why. This statement is false because simply using a larger brief does not address the cause of incontinence and may increase skin risks. The CNA should report patterns and follow the toileting or continence plan. That is why this answer is correct.
Here is question number 46. Focus on the keywords. It is the nursing assistants, CNA's, responsibility to provide the following care related to urinary incontinence. Here are the choices. Choice A, toilet residents according to the person-centered plan of care. Choice B, report skin changes immediately. Choice C, intermittently catheterize the resident. Choice D and B, choose your answer now.
Time to check your answer. The correct answer is D and B. Great job if you selected that. Let's understand the logic. CNAs help by toileting residents according to the person-centered plan and reporting skin changes promptly. Intermittent catheterization is a nursing task and is not part of the CNA role unless allowed by specific facility policy and training.
Now let's try question number 47. Do not rush this one. If two answers seem correct, look for the most complete one. A resident is experiencing incontinent episodes related to extended periods of time spent in activities. As the CNA, here are your choices. Option A, quietly, while maintaining privacy, remind and assist the resident with toileting before, during, and after activities as she allows. Option B, privately speak with the resident about the possible ways to prevent incontinent episodes. Option C, tell the resident she must toilet at specific times. Option D and B, lock in your answer.
Time to check your answer. The correct answer is D and B. Mistakes are useful when you understand the reason. For the exam, remember this. The CNA should protect privacy, offer toileting around activities as allowed, and discuss prevention respectfully. Telling the resident she must toilet at specific times removes choice and is not person-centered. That is why this answer is correct.
Here is question number 48. Focus on the keywords. A UTI places residents at risk for sepsis. Signs of sepsis related to a possible UTI that need to be immediately reported to the nurse include. Let's go through the options. Choice A, difficult to awaken and increased confusion. Choice B, foul-smelling urine. Choice C, respiratory rate higher than 20 breaths per minute and heart rate higher than 90 beats per minute. Choice D, all of the above. Pause here if you need more time.
Time to check your answer. The correct answer is D, all of the above. Great job if you selected that. The main idea is this. All listed findings may signal UTI complications or possible sepsis and should be reported immediately. Confusion, difficult awakening, foul urine, and abnormal vital signs can indicate serious infection. That is the key takeaway.
Here comes another one. Choose the best answer, not just an answer that sounds familiar. It is part of the nursing assistants, CNA's, role to demonstrate ways to help prevent UTIs when helping the resident. Examples of common avoidable causes of UTIs among women include: pick the best choice from these options. A says wiping from back to front, B says remaining in a soiled brief, C says and, D says none of the above. Ready for the answer?
Here is the correct answer. The correct answer is C and B. This is why practice matters. Here is why. Wiping from back to front and remaining in a soiled brief can introduce bacteria and increase UTI risk, especially for women. CNAs help prevent UTIs through proper perineal care and timely brief changes. That is the key takeaway.
Let's continue with question number 50. Look carefully at what the question is asking. Examples of factors that decrease the possibility of UTI or trauma in a resident with a urinary catheter are. Listen carefully to each choice. Choice A, bag and tubing held above the level of the bladder. Choice B, catheter bag properly hung on wheelchair. Choice C, failing to anchor tubing to prevent pulling or tugging. Choice D, changing from the leg bag to the drainage bag often. Take a moment to think.
Let's see if you got it right. The correct answer is B, catheter bag properly hung on wheelchair. Excellent work if you picked that one. Let's break it down. Keeping the catheter bag properly hung below bladder level on the wheelchair helps drainage and lowers infection or trauma risk. Raising the bag above the bladder, failing to secure tubing, or frequent unnecessary bag changes can increase problems.
Let's continue with question number 51. Look carefully at what the question is asking. Ways to make sure residents have adequate hydration may include. Choose from the following options. Choice A, offering residents fluids with every interaction. Choice B, encouraging him, her to drink all of his/her fluids at mealtimes. Choice C, offering fruit. Choice D and B, try to answer before the reveal.
Let's reveal it. The correct answer is D and B. That was the best choice. The main idea is this. Offering fluids frequently and encouraging intake at meals can support hydration when allowed by the care plan. Fruit can help with fluid intake too, but this item identifies A and B as the correct combined choice.
Moving to question number 52. Pay attention to the wording. Examples of changes in a resident that may indicate a UTI and should be reported to the nurse immediately include. Listen carefully to each choice. A is new episodes of incontinence. B is pain in lower abdomen or back. C is difficulty starting urine stream or changes in the urine. Example, color, odor, looks different or cloudy. D is all of the above. Take a moment to think.
Now for the correct answer. The correct answer is D, all of the above. If you chose that, you are correct. This answer is correct because new incontinence, lower abdominal or back pain, difficulty starting urine, and changes in urine color, odor, or clarity may indicate UTI. These changes should be reported promptly for nurse assessment.